All right, I'm really excited about this interview for Limitless for a couple of reasons. First of all, I get to interview and talk to my friend, Bridgitte Mallinson, who is the founder and CEO of GutPersonal. What's really awesome about this is Bridgitte is actually, or GutPersonal is sponsoring Limitless this year, which I'm so excited about. I'm so excited for Bridgitte to share her story about why she's passionate about gut health, about women, about all of these things. So it's just the perfect pairing, but I got a really cool opportunity to spend a few days in Costa Rica with the amazing Bridgitte. And her energy is amazing. Her passion for the work that she does is incredible. And I'm just really pumped for this partnership. So Bridgitte, thanks for being here.
Thank you so much. I'm so excited to be a part of your community and Limitless. Just really excited.
So let's start with just a brief introduction. Tell us about you and how you got here to running GutPersonal.
Yeah, so I think it's important to go back to my health struggles and then how I got into this. So I was in school to become a dietitian in undergrad, and I was on 5 different medications for 5 different things. I was on thyroid medication, migraine medication, ADHD meds, birth control to regulate my hormones, everything under the sun. I was on Miralax to go to the bathroom every day. And my body was falling apart. And I was the healthiest eater I knew. And so what I was learning in undergrad was food is medicine.
Right.
And I was eating so healthy, but it wasn't shifting anything for me. And I know a lot of women can relate to that. I've been doing everything. My labs are normal, yet I've been put on another medication, or I've been just told, go home and try to feel better. And so that happened to me. And being a dietitian, I was like, this doesn't make sense. If food is medicine, why don't I feel my best? I'm just getting dismissed by doctors. And so I found the field of functional medicine. And functional medicine really gets to the root cause of imbalances. So I interned, and as us high performing women do, I immersed myself after going to school for 6 years, undergrad, master's. I was like, all right, I'm going back to school. I have to learn this for myself. I have to heal myself, and then I want to heal my clients. So I went back to school and I interned with the leading doctor in functional medicine, Dr. Mark Hyman. And most people know him from Instagram and, his work. And I interned with him and I learned about how I could heal my body. Everything I was going through, every medication I was on, every symptom I had, all stemmed back to my gut. My thyroid was gut related. My migraines, gut related. My ADHD, gut related. Everything I was going through was all because my gut was an absolute mess. And so I healed that and then started bringing it into my practice. I was working with women one-on-one and have been for the last 8 years, and really was seeing so much change and so much power in personalized medicine and personalized nutrition.
Yeah.
So, when the pandemic hit, I launched my company online. It was originally just working with women one-on-one with their gut health. And then, as us high-performing women do, we say, okay, what's the next thing that I can do? And that there was such a problem in the supplement industry. It wasn't personalized, so much lack of education, so much lack of empowerment.
Right.
And so I saw this huge need and I launched GutPersonal November 11th, 2021. And took on female investors, and it's just been such an incredible journey with this company. So that's what I am. That's who I am. That's why I do what I do. Right. And I'm so passionate about helping women.
Well, and I think there's a couple things in there, right? And I want to talk about the medicine side, but the part of like the number of people I know that have been dismissed by their doctors for their symptoms, or that the symptoms don't get tied together, right? Well, it's like, oh, well, you have headaches, but the headaches don't get tied to the fact that you're not sleeping well, right? Yes. Or they don't get, like the dots don't get connected. And I hear it over and over again. And sadly, the older we get, right? And then we're like, oh, it's just hormones, or, oh, you just had a kid, or, oh, you're getting into, like I turned 40 this year. So,
yes,
down like the perimenopause road and all that other stuff. My mother went through menopause early and all of this. And so, there's all of these things and they just get kind of brushed under the rug, or you get brushed off, or nobody's looking at the big picture. So talk to me about like, what do you mean by your gut was a disaster and everything tied back to your gut? Can you drill it down into that a little bit more, Bridgitte?
Yeah, well, I think you're 1,000% right. It feels like being thrown under the rug, that you don't know actually what's going on in your own body. It's incredibly disempowering. So the first step that I had to do was work with someone else who wasn't myself.
Of course.
And they were looking at the bigger picture, hey, all of these symptoms, because really many times a diagnosis is really just a set of symptoms.
Sure.
So instead of us looking at it as I was diagnosed with migraines or ADHD or hypothyroidism, just thinking about those different systems in the body and how do they interact. And so who I was working with was able to determine, okay, a lot of these could be gut related. I'm not 1,000% sure. Let's test your gut. Let's test your hormones. Let's test a couple things, which this type of testing that functional medicine uses is not mainstream. It's not something you can get done at your PCP. Very in depth, it's literally a poop test.
Right.
Yeah. And so that's what I did. And it showed a lot of bad bacteria that affects so many things in the body. It showed I had a very severe gluten sensitivity. Interesting. And it showed all of these things. And so as I started to heal those, all of these symptoms went away. And so, by process of elimination, I didn't need to be on focus medication, Adderall anymore. When my focus was great, it was just bad bacteria in my gut.
Right.
That was affecting my neurotransmitters, which basically regulate our focus.
So how does someone get like somebody to pay attention? Because you would never think of that, right? When you say migraines, hypothyroidism, ADHD, having a hard time paying attention, how does that is really only a functional medicine dietitian going to help you figure out that it's your gut? Is everybody else going to point to neurology and neurological and all the other things?
Absolutely. And what you just said is these different silos of medicine, right? Go to neurology, go to an endocrinologist, go to a gastroenterologist.
Right.
But a functional medicine dietitian or a functional medicine doctor, a lot of us functional medicine dietitians actually have as much education as a doctor. Sure. I went to school for 10 years post-grad. So dietitian or doctor. Right. And what I found is that us dietitians, we are looking at it ultra holistically because we've never been trained in prescription medications. Right. So it's not just, using natural medicine, as you have this, take this. We're saying, what is the bigger picture here?
Sure. And what's also really fascinating, and then I want to talk about the supplements a little bit. So I had just recently gone to my primary care physician because I needed to get prescriptions renewed. So I take allergy medication, and I told her, what else is going on? She's checking the boxes, asking all these questions. And I was like, oh, have I been sleeping well? And no follow-up. I really like my doctor, but no follow-up questions, no, nothing. She's like, well, I can prescribe you this, this, and this. And I'm like, again, 39 years old, run a business, 2 small kids. I'm not taking sleeping medication every night. I'm not doing that. And obviously, and I think of you in the magnesium supplements, which, by the way, I've been taking for 4 nights and I have slept all 4 nights. So, which is very, very exciting, but that was her first thought. And again, I'm not mad. It just is what it is. So let's talk about the supplements and what they're designed to do, and how they help, in this instance for me, sleep.
Yes, absolutely. So we have a whole line of supplements, but really our mission and what we're really striving to do is personalize them. So I know for you, and what I recommend to many people is we have this quiz, and it's not just the quiz that comes out of a magazine that maybe asks you 4 questions. You know what I mean?
This is not a marketing funnel quiz, friends. This is an actual quiz.
This is an actual quiz developed by actual experts, myself and another functional medicine dietitian. And it's really accurate, but efficient. So it's 10 questions to say, what's going on with your body? What are you struggling with? What are your goals? Right. And we've had women get incredible results.
Sure.
You know, I wanted an accessible way for
Right.
people to reach functional medicine. Functional medicine is extremely, you know, an investment.
Of course.
When you're working with someone, you know, to do a test, we charge $1,500. So
Sure.
I took all that data from tests that I had done forever and put them in this quiz. So we then develop a personalized protocol for you when you take the quiz. And then we also have dietitians on staff who have a call with you, you know, who help you personalize further, answer any questions, because at the end of the day, if you feel empowered, and the same goes in business and in life, if you feel empowered to do something, you're going to strive at it, right? Like you're going to kill it.
Yeah.
And so we're really working to not only say, here's your supplement protocol, but here's the why, and here's how it's so supportive for you. And I think especially high performing women, health has to, like for you, sleep.
Yeah. Yes.
If you don't sleep well, how can you show up the best for your business, for your kids? And it's a very easy thing. So, I mean, the magnesium, like you said, taking that, it's so powerful, and it's actually changing a deficiency that you have in your body, versus the sleep meds is just going to change your chemistry in not a positive way.
Right. Right. So let's talk about the quality of the supplements too, because, you know, we've all heard of magnesium. It was actually started when I was expecting, you know, when you had a hard time sleeping when you're pregnant, you know, it's the calm magnesium, the big giant bottle on Amazon that they're like, here you go. At least that's where I bought mine. So, you know, magnesium for sleep is not an uncommon prescription, right? For lack of a better term. Let's talk about the importance of the quality of the supplement for a quick second.
Yeah. So it's all medical grade. There was something off because most medical grade supplements are not available to the public.
Got it.
And so I wanted to bring the highest quality to the public, to women, like that we can actually take the highest quality. And it doesn't necessarily always mean more expensive. So that's something. It's third-party tested. So we make sure it says it is what it is. It doesn't have heavy metals. There's so much in the news right now about, I don't know if you saw this recently. There was like crap in orange juice.
I can't.
You're like, what the hell? So it's so important that like products you're ingesting every day don't have crap in them, like heavy metals, and there's so many other things, pesticides that could be in them. So
and I think that's why I have always been I was so excited to meet you and to learn that you were doing this, because supplements there's not a lot of regulation, right? So you can go to Walmart and buy, and I'm not knocking anybody in their business practices. I'm not saying because it's sold in Walmart, it's bad, but the barrier of entry is relatively low. So it's like, how do I know why this magnesium supplement costs $35 and this magnesium supplement costs $7? Right? Like, how do I make that decision? So I love kind of hearing you walk through the steps that you've gone through and the difference of like that medical grade and not, because it can feel really overwhelming when you're like, I know that I need something, but there's so many choices and it's not super well placed. So people can do whatever they want. And that's terrifying.
Yeah. And I think, you know, our antithesis to overwhelm is empowerment and education. And, you know, that's, I think such an important thing that we're all working on, right? Is like, whether we're an entrepreneur or whether we're building a team, is like, is shifting that narrative. And so that's what we're trying to do in the physical product space. We're doing something that maybe many of you who are coming to Limitless or listening to this are trying to do, is shift perspective, and empower.
Yeah, it's so good. And what's funny, when I was buying my supplements, it was the middle of the night when I couldn't sleep. And I had talked to Bridgitte like the day before. We were talking about her Limitless. And I was like, I just like took the quiz. So whatever it told me to buy, I just was like, purchase. It was like 3:30 in the morning. I'm like, send me all the things.
Yeah. I mean, sometimes it's like that breaking point of, we're like, all right, and now I'm going all in.
Yeah. Yeah. I think it's really fantastic. And not to mention just the fun part of, you know, a female-owned supplement company and women doctor and just all the fun, really cool, feel good part of it. But you also being really, really passionate about your people. And that's so clear. Your energy is so good. So I have one more question for you before we wrap up. And I've asked all of our speakers this. So what does Limitless mean to you?
Oh, this is such a good question. Oh, and I got goosebumps because like Limitless is just so powerful. Like that word, it's without limits. And I truly believe that our mind sets what we believe our limits are on ourselves. Right? We all hear this phrase, limiting beliefs, but what if we had limitless beliefs? And I think that's been something that's actually been so powerful for me in working on what I believe is possible for myself as a female entrepreneur, what I believe that I can do. You know, one of my goals, having such a big passion for this company and knowing I can bring it to so many women, one of my goals is to be such an inspiration for women and sell it for how much all of these male-owned businesses are selling for, you know?
Yeah.
So limitless to me really means it's a mindset. It is that I have no limits. I can really like see my full potential. I'm taking action and I'm not allowing, I call the subconscious, the biatch in the back.
Yeah, I like it.
Runs the show. I'm not allowing my limiting beliefs to affect what I think I can do in the future. So I'm so excited about Limitless. Like this word, this energy, you guys have to get in on this.
I know. It's so good. It's so good. So if people are interested in taking the quiz, checking out the supplements, or just hanging out with Bridgitte more, because she's just amazing, where can people spend more time with you and find out all about Gut Personal?
Yeah, so it's gutpersonal.com. You can take our quiz there. And then I'm Bridgitte Mallinson on Instagram. Of course, Gut Personal has a fabulous Instagram as well. That's where we are a lot. I'm in the DMs constantly. And I love to connect. Connection is one of my, huge core values. And so I can't wait to connect at Limitless too. And so, yeah, that would be fabulous. And I think we'll have a discount code for the community. So go take the quiz, use the discount code, and we'll go have a blast.
Yeah, it's going to be so good. And I'm super serious. If anything in your body is feeling weird, you don't feel right. It was a super simple process. My supplements arrived quickly. I'm like 4 days into my protocol. And the biggest thing I noticed is sleep, is I'm sleeping and I was not. So whatever it is for you, go do it. It's amazing. Bridgette's just amazing. And you should follow her on Instagram, because it's impossible to spend time with Bridgitte and not smile, which is just good energetically across the board. And we look forward to seeing you all in Limitless in April. Bye.